Hello, my name is Chad Walker and I'm the host of the Higher Living Show. And today you are going to see a response to the criticism of the Australian medicinal cannabis industry that is increasingly heating up. This week we saw the ABC release an article that has the criticism of the Australian Medical Association, the AMA, and the Royal Australian College of General Practitioners. Within this article, some of you would see that there's criticism of the quality and the standard of care and the safety of the products that are prescribed and available for Australian patients. But I'm saying this with caution. And in some ways today, I'm sending a message out to patients, to prescribers, to the entire industry. Because for a while, many of us, including myself, have been saying we need to get changes. We need to get changes, and we need to get changes for these reasons. The word of caution and the reason why I'm coming on today is because at times we can want something, but what we want may actually not be the result. And I'm going to highlight a few key points that I think anyone with a vested interest in this plant for its medicinal properties, anyone that's interested in access for patients, needs to take note of a few key things that seem extremely alarming. Now, before I get going, I do need to put my hand up and have transparency. Last year at the United in Compassion conference that was hosted, I had some criticisms of the industry. Many have had criticisms of the industry. I was there saying, if we're going to have I was quoting Jeff Bezos from Amazon, and I said, at times, if we're going to have a rock concert, you can have a rock concert and you can have a ballet. Just don't disguise and promote the rock concert as a ballet. Basically, just be authentic and transparent around what you're doing. One of the big prescribers, Dr. James Stewart, as well, has been very vocal along the words of don't ruin it for the rest of us. I'm not going to get too deep into some of the areas of concern that we see in the industry. But what I am going to reference is Tom Varga, quotes from Tom Varga last year, a CEO within the Australian industry. What he mentioned was that at times, without all the infighting, we've kind of got to pat each other on the back a little bit more and be more supportive of the progress that we're making with a focus on access. And I think that is a key point that I don't think has probably been given enough attention. So I've got to give credit to Tom for those words. Now, just to be transparent from my side, in terms of the changes that I was promoting, the changes that I was promoting were in accordance in the beliefs of a number of different things and a number of different trends that we see in healthcare. Firstly, we know that there is a lack of trust with big pharma and the traditional model of healthcare. We know that, and we know that people are seeking alternative and more natural therapies, not only because of the mistrust that has occurred, but also because of the quality of medicines that have been available. The quality of medicines that have been available have been at times not effective or equally effective as you can get from a more natural medicine such as cannabis or other therapeutics, but let's focus on cannabis for now. And importantly, may not have the unwanted side effects that have been within our families and our communities for decades. Basically, what that means is one can be unwell, you can go seek a pharmaceutical product, and you may get relief for that, but at the same time, there may be a number of different factors that come along with that which are undesirable. As a result of this, and we see the promise through some of the early findings that we've been seeing in cannabis, is that cannabis as a medicine has huge therapeutic benefits and huge potential. Now, one of the things that I've been saying is while we've got a growing body of evidence and a growing body of research around certain indications, I don't believe that that should limit how we prescribe and what patients should be able to access, particularly if patients should be empowered to make choices for themselves. Because what that means, if we were only to rely on top quality evidence, the range of prescriptions that would be available wouldn't be sufficient to meet the market needs of where Australian patients and the growing population of patients around the world are, for the very factors that I mentioned around why there's a shift in terms of where patients are trying to seek their healthcare from. My idea in starting on Tracker was to support access, but at the same time, be mindful of a moment that may be coming like this to say, hey, we know that we may not have the randomized clinical trials, the data from the randomized clinical trials at this moment to support a prescription of cannabis for pain, or to support a prescription of cannabis for anxiety, or for depression, or PTSD, or for sleep, or for endometriosis, or for a whole range of different factors. But we also do know that there are potential and there's anecdotal evidence to support it. So what we can do, and while the TGA has set up a system of a SASB to be able to support the introductions of these medicines into patients' lives, let's start collecting the data so that we can show this is what we have found for indication A, B, C, or D. I've been talking about this for nearly 5 years, and I think the moment has come where some of you may start to think, wow, maybe what On Tracker was doing had a little bit more value than we saw at the start. It's not us. It's not the time to go into this. It's more time to dive into what some of the concerns are in what I see from the article. And anyone that has been around this space for a period of time may not be surprised to hear some of the quotes that are coming out of this article, particularly when I cross-reference this to someone that I respect greatly in the industry, and the exact terminology has now started to show up in some of the reports that he's receiving from insurance companies. At times, you need to be able to connect the dots. And let's dive into this real fast. So one of the things that you're going to see in the article is the wild claims about benefits. Yeah, the wild claims about benefits. Now, what does that support, right? What does that support? That again supports, that only supports the option if there is good scientific evidence. And we know that all we've been focused on in cannabis is researching harms. So we are yet to be in a situation where we have the quality of research for a whole range of indications. So if we're looking at wild claims, what? So individuals that have PTSD can benefit. We know that this is an option for endometriosis. We know this helps many different indications, right? But if we're only focused on areas that are supported by good scientific evidence at this stage, all we're going to be able to see, and the quote is here, is that it can be useful for epilepsy or for palliative care. So if you're out here as a patient and you think I'm ranting a little bit too much, or you're a prescriber and you're like, but I prescribe and I'm fine and we do it the right way, we do standard appointments. What happens if we get to a point where all you can prescribe for is epilepsy or palliative care? Let that sink in, because that's where that's where good scientific evidence is, and there's emerging research for other areas that are supported. But if their quote is only epilepsy or palliative care, this is back. We're going back by almost a decade to the exact same things that we heard prior to Dan's law coming into effect in Australia, right? The wild claims, we're seeing that they're untrue or unproven. This is a way to then be able to say anyone who's talking about cannabis is a conspiracy, is wearing the tinfoil hat and it's a conspiracy. There isn't any good scientific evidence to support it. This is the key quote to look at. In many cases, there were other medications that were more effective or more suitable for a given patient. This goes back to the pharmaceutical model. Okay, you've got depression, you're coming in for anxiety, you're coming in for pain. We've got much better medications that are supported by randomized clinical trials to support you to be able to feel better. Don't worry about the unwanted side effects. And you can drive on these opioids as well. You can't drive on cannabis. This is what we're getting at. This is huge discrimination, right? You've got to be mindful of this language. There are other medications that were more effective or more suitable for a given patient. That is a big warning sign for patients and prescribers in the industry to be made aware of. The other thing that I'm going to close with is that in the report, they try to use a scare campaign here to say there's been 600 reported adverse events. 600. And what we see, you can see there's some drowsiness, which is probably helpful for the prescription of sleep. Just be mindful of that. We can see some other areas such as nausea, etc., which are mild side effects. Yeah. But 600 reported adverse events. And if we know there's been over 1 million prescriptions in Australia for medical cannabis, we are seeing that the rate, if we're reporting 600 at 0.06%. So what they've done there is actually confirm how safe this is as an option, as a medicine, but they weren't able to connect that. They weren't able to connect those dots. My message for the industry is we need to be stronger together. We need to be a joint voice that is focused around access, and we need to work together much more to be able to collect this credible, robust real world data so we can evidence and we can highlight to the world and we can highlight to Australia and we can show patients the industry has your back and we're not going to take away your medicine and we are going to improve the standard of care. Yeah, there's things that we can get right. Yeah, there's things that we can do better. But we've also got to stop and acknowledge that patients are getting access. The data shows it's relatively safe at this moment, or extremely safe if we're looking at 0.06%. And we need to continue moving forward with the best interest of patients, and that is continuing to allow access and to support frameworks for access within Australia. My name is Chad. I'm the founder of OnTracker. You can find out a little bit more about that. I'd love to see your feedback, and I would love to see what sort of thoughts you have about how we can continue to work more collaboratively. This is Higher Living. Thank you very much.